We are back again at University Cancer Blood Center with Dr. James Splichal, hematologist and oncologist. And we just wanted to discuss, as November is Lung Cancer Awareness Month, what does lung cancer prevention and what does screening look like for lung cancer?
Well, prevention, as with any cancer, it's so important to not get cancer if you can help it. So the most important thing is to not smoke and to stop smoking if you can. So about 90% of lung cancers are related to smoking. Even if you've been a long time smoker, there's so much benefit in stopping or cutting down. And so I would encourage everybody out there who is smoking or has loved ones who smoke to try to cut back and to quit smoking. That's a lot easier said than done for a lot of people, but that's the number one thing that can be done to help lower the rates of lung cancer. If you do develop lung cancer, just like with any cancer, the most important thing is to find it early. So we're used to women having mammograms. We're getting more and more used to people having colonoscopies when they turn 50. So just like with breast cancer and colon cancer, there are now prevention studies that you can do for lung cancer. And so that's why we're here in our CT scan room here at UCBC today, because if you're between the ages of 55 and 75, and you have smoked more than 30 pack years, meaning on average a pack per day for 30 years, it helps to get a screening CT scan to look for lung cancer. And what we would do is a low dose CT scan so there's less radiation exposure. So just like women once a year may get a mammogram, you could once a year get a chest CT scan with the goal, if you were to develop lung cancer, to find it early. So that is so important to find lung cancers early. And we are participating in that, and you would get a low dose CT scan on a machine, maybe this machine or a machine just like this one.
Dr. Splichal, are there any myths that you think are around lung cancer that might be benefit for us to be able to share?
There are, and so probably the number one myth is smoking causes all lung cancers. And although it causes the majority of lung cancers, about 10% of people who develop lung cancer have never smoked or been around anyone who smokes. So if you think about that, that's 25 to 30,000 people per year in the United States who develop lung cancer who are non-smokers. So not everybody who gets lung cancer is a smoker.
That's good to know. We heard that straight from Dr. Splichal that you can have your CT scan done here at University Cancer Blood Center. Thank you so much for joining us about prevention and surveillance.